Recent developments in the UK political landscape have sparked a fierce debate surrounding the Labour government's claims about NHS appointment increases. Prime Minister Keir Starmer and Health Secretary Westing have touted the delivery of over 3.6 million additional NHS appointments within an 8-month timeframe, seemingly eclipsing Labour's original pledge of 2 million for the first year. On the surface, this appears to be a significant achievement. However, a closer examination reveals that the narrative may be more about political manoeuvring than genuine progress. Let's take a step back. During their election campaign, Labour promised to deliver 2 million extra NHS operations, scans, and appointments annually, an ambitious goal aimed at signalling a turnaround in a beleaguered healthcare system. After the pandemic wreaked havoc on waiting lists, Labour positioned itself as the party willing to tackle this crisis head-on. But the Institute for Fiscal Studies, IFS, a respected think tank, has labelled Labour's goal as underwhelming.
Why?
Because NHS activity was already on the rise before Labour took office. The IFS pointed out that under the previous Conservative government, led by Rishi Sunak, the number of additional appointments had increased by 4.2 million over a comparable 8-month period, outpacing Labour's 3.6 million. This comparison is crucial. Labour's much-lauded increase actually signifies a slowdown in growth. The Conservative administration had witnessed appointment increases of 10% in 1 year, followed by an 8% rise the year prior. In stark contrast, Labour's target of 2 million additional appointments only amounts to a 2.9% increase compared to the approximately 70 million total annual appointments. So, what's really going on? According to Full Fact, an independent fact-checking organisation, Labour's celebrated figures may not be as groundbreaking as they seem. Full Fact's investigations through Freedom of Information requests revealed that the government had effectively shifted the benchmark by comparing a narrow 5-month period from July to November 2024 with the same months in 2023. While they adjusted for working days, they failed to provide context regarding NHS activity under previous administrations. This lack of transparency raises doubts about whether Labour's claims reflect genuine progress or if they're merely capitalising on the momentum generated by their predecessors. Even Labour's own definition of what constitutes an appointment was vague. It wasn't until they claimed to have met their target that they clarified it applied only to elective non-emergency procedures, outpatient appointments, and diagnostic tests, excluding mental health and maternity care. Consequently, measuring real monthly progress became nearly impossible, overshadowed by the ambiguity surrounding their initial pledge. Health policy experts echo the sentiment that Labour's target is inadequate. Sarah Scobie, Deputy Director at the Nuffield Trust, emphasised that the 2 million figure falls short of addressing the systemic issues plaguing NHS backlogs. To genuinely restore pre-pandemic standards, a significantly faster growth rate in NHS capacity is essential for meaningful patient improvements. Despite the mounting evidence and criticism, the Department of Health and Social Care remains steadfast in defending its claims. A spokesperson pointed out that Labour had been warned of potential cuts of 20,000 appointments per week due to financial constraints upon taking office. Instead, the government injected additional funding, resulting in reduced waiting lists by 200,000, a more notable drop than what was achieved under the Conservatives during the same period. This is indeed a valid point. NHS waiting lists have fallen by over 200,000 since Labour assumed office in July 2024, marking the largest decline from July to February since records began. Additionally, the percentage of patients awaiting treatment for less than 18 weeks has started to improve, a significant milestone given the NHS's struggles with 18-week targets for over a decade, aside from a brief period during the pandemic. Yet, despite these positive trends, the overall landscape remains grim. As of March 2025, 6.25 million individuals were still awaiting NHS treatment in England, with a combined total of 7.42 million treatments pending, representing over 10% of the population. Alarmingly, while long waits have decreased, more than 180,000 people have been on a waiting list for over a year. Although this is a dramatic improvement from nearly 400,000 in August 2023, it remains worryingly high by pre-pandemic standards. These statistics may be technical, but they translate into real human consequences. Behind each number is a person in need of a knee replacement, a cancer scan, or a mental health consultation. These aren't just figures, they represent individuals enduring uncertainty, pain, and deteriorating health. A drop in overall numbers doesn't necessarily equate to faster service at the local level. Many patients across the country still report challenges in accessing appointments with GPS or specialists, despite the government's optimistic narrative. Labour also set a long-term goal. By the next general election, no more than 8% of patients should wait more than 18 weeks for treatment. Currently, that figure exceeds 40%, highlighting the substantial journey ahead. Public sentiment appears to align with reality. A recent YouGov poll for Sky News revealed that 39% of Britons believe the NHS has worsened over the past year, while only 12% perceive any improvement. When asked about trust in political leaders regarding NHS issues, Keir Starmer fared better than some rivals yet still faced skepticism. 60% of respondents expressed distrust in him on NHS matters, compared to 30% who did trust him. Though better than some, it's hardly a resounding endorsement. Former Health Secretary and Chancellor Jeremy Hunt criticised Labour's approach, contending that meaningful improvement hinges on enhancing capacity and productivity among doctors and nurses rather than merely increasing funding or counting marginal appointment gains. He accused the government of channeling most of the NHS's new funding into pay increases without achieving efficiency gains, an assertion echoed by Edward Argar, the current Shadow Health Secretary, who described Labour's claims as a feeble attempt to take credit for progress already underway. So, is the NHS genuinely improving or deteriorating? The truth lies somewhere in between. On one hand, waiting lists have begun to shrink, and some patients are being seen more promptly. On the other hand, the enormity of the backlog remains staggering, and the government's self-proclaimed success may not be as revolutionary as it suggests. Progress is evident, yet perhaps not as dramatic or swift as Labour would have voters believe. In the end, it's up to voters to determine if Labour's strategy suffices. The government has time before the next election to demonstrate deeper results, but public expectations are soaring, and patience is waning. The NHS is one of the UK's most cherished institutions, and citizens demand more than mere statistics. They seek care, efficiency, and accountability. As it stands, the narrative is complex. The numbers tell one story, the government spins another, and public skepticism remains palpable. Only time will reveal whether genuine reform and lasting improvement materialize or if this is yet another political promise destined to crumble under scrutiny.